Hey everyone, hope that you're all doing really well. It's me, Margot. Today is my week 26 or 6-month update post-op for my Roux-en-Y gastric bypass surgery. I know everyone says this on their videos, but I really am dumbfounded that it's been 6 months because it's gone by a little more quickly than that. I actually just got home from my 6-month follow-up appointment with my surgeon as well, so I'll be able to give you a little bit of information there. First, we'll get to the stats. Okay, so last week, what was that last week? I think 203.8. I'm pretty sure that's what I was. This morning I was 202, so I lost 1.8 pounds. I'm at 202, which is good. I lost 39.2 pounds before my surgery, and I've lost 82.8 pounds since my surgery, bringing my grand total to 122 pounds. I'm really happy about that. My goal was to lose about 150 pounds, so I'm on my way. I asked my doctor, I had a really great time. He takes a lot of time with me, which is really a blessing. He told me that I was doing, quote, phenomenally, which really made me feel good. And it's funny because he said he could tell before my surgery that I would do well. You know, a big part of the surgery, a note here to pre-ops, is that you have to be fairly intelligent and educated to some degree. Not that I'm that smart, because I'm not. But you really have to get all this. One of the hard things is juggling all of the, you know, what to eat, what not to eat, when to take this vitamin, when not to take that vitamin. And so he said he could tell that I was getting it anyway. And I guess that's a good thing. Hopefully I've got it by now. I had mentioned last week with my lab work, the only thing that really came in low was my protein, which I've upped. And I kind of expected that. He told me that's surgically, even though I was hitting my levels. He said that's just because of the surgery, and that's why they make you take so much protein, because your body just can't absorb all of it. He's not too worried about it. And he said I was at the level that they expected it to be. The prealbumin is what they look at for that. He told me to probably, even though I was in the normal range, I think, he told me to up my my B12. I've been taking just regular vitamins. I was not taking an extra B12. So I'm going to start taking, I had some sublingual drops that I had before, and I'm just going to keep on using those. So that's good. But he was just really encouraging, and he told me, you know, he could tell that I had lost. I told him about my stats regarding my triglycerides being down and my cholesterol being low, and he goes, good God, your numbers are better than mine. So I thought that was good. But on a cool note, my resting heart rate was 68. I think before it was about 92 to 95. So that's really encouraging. My heart's getting in much better shape. And he said basically just keep on keeping on and stay on program and stay on task, and that's good. I would tell you that a big part of the reason why, and my blood pressure was real good too. It was like 110 over 70 or something like that. And I think a big part of the reason why, particularly my blood pressure and triglycerides and whatnot, are lower because I'm not in a stressful situation. I'm not working right now. My job before was really stressful, and I haven't been working since April. This is my I won't call it my year of my sabbatical, but I'm hoping to take a few more months out just to kind of keep my focus on myself and be able to take this time. If any of you, you know, have the option to take some time off of work or whatever, I would tell you that with the job that I was doing, there's no way I could do as well as I am doing, because I wouldn't be able to exercise as much. When you're stressed, you come home, you're exhausted, you just don't have the time or the energy. So that's helpful. Now, on a not so great level, I've got 2 teenagers at home. I've got a 16-year-old that's making life sometimes very stressful. And so it's a different stress and, of course, a different focus and priority for me at this point in time. So, and it's all well worth it, of course. But, of course, I won't reap those benefits for years to come. Anyway, but that's pretty much it. So this is stuff that I've kind of shared in the past, but so I'm wearing a size large or extra large on some shirts, 14, 16 tops basically, and I'm wearing size 14, 16 jeans. I have a pair of 14s, I have a pair of 16s, they both fit me. So all's good. Just kind of learning to keep the focus, kick it in gear, and hopefully continue to lose. He told me it would slow down at 6 months, and he told me that the head hunger would be coming back. Certainly staying away from the carbs is going to help me. But every now and then I need to have some carbs, and I do that. I'll have like a piece of whole wheat toast, really thin, good good hearty whole wheat toast with some natural peanut butter on it, which to me is like a huge treat. And protein, the peanuts are protein. Oh, one thing he did notice, because I did ask him, I could tell, I've had a hernia. I had a tubal pregnancy back in 1990, and they went in laparoscopically through my belly button and removed the pregnancy and the baby, and that created years later an umbilical hernia. That plus my obesity created an umbilical hernia. So I had that fixed in 2002, so 6 years ago. When I had my surgery, he said there was a ton of scar tissue, and I could tell because certain things I eat and stuff, you could tell it was pulling, and you felt like your intestinal wall was attached to your skin, and it was kind of hard. Sometimes I put pants on, I'd get the sharp pain. So about 45 minutes of my surgery, he spent cleaning up scar tissue from that hernia and repairing the hernia again. The last couple times that I've gone in to see him, I said, I think that hernia is back. And no. But this time, you could see in my stomach there's a little bit of a bulge, and he felt it with me, excuse me, standing up. He said, yeah, that is. He goes, it's popping a little bit. He goes, I'm not too concerned about it. And he goes, what we'll do, he goes, unless you want to take care of it now. I'm like, no, I really don't want to, because I don't want it to slow down my weight loss recovery. And he said, he agreed. He goes, yeah, it's more important for you to stay on track right now. Because what we'll do is we'll submit a request for hernia/tummy tuck when you're out, when you've stabilized your weight for 6 months. I'm like, yes, tummy tuck. No, it's not to say that it's going to be covered, but wouldn't that be great? That'd be kind of cool. Anyway, so then that means that all I'd have after that is a breast lift. So if I could kill two birds with one stone, man, I'd be a new woman. But I asked him, I said, how much do you think I'll lose? And he said, probably about 30 more pounds. I may have mentioned this already. Maybe I'm losing my focus here. And I'm okay with that. That's right around where I want to be for my goal. So about 175 is what I figured. And I feel healthy at that. I want to have a goal where I'm comfortable and I don't have to feel like I'm busting my butt and can never eat some things that I want to eat in order to stay there. I don't want to get down to a size 5. That's just not where I'm at. My body wasn't built to be like that. I think I have, my husband kind of mentioned this. He goes, I'm not saying you're big bone, but I think that you might be a little bit bigger boned. I'm not tiny, but I'm proportioned. My sisters are tiny on top. They're typical pair, with the wider hips, but small waist and small top. They're very small on top. They don't have a bust like I do. And I don't. That's not me. I'm pretty much, even though I got really big, I'm big all over. I was big all over. So I now that I'm slimming down all over. So I'm really grateful for that, to be proportioned and not have like something way out there, like my hips out there, but my, butt being small, whatever. So I'm kind of losing it all over, and I think it's a combination of genetics. I think it's a combination of the workouts that I'm doing, and hopefully this diet is helping. But yeah, he told me that with my triglycerides being low, he's really thrilled. He said, yeah, the cholesterol and triglycerides is a 1-2 punch risk factor for heart attacks. He goes, you had both. You had high cholesterol and you had high triglycerides. He goes, you were a heart attack waiting to happen. And those are hard words to hear, but I'm really grateful that I'm not there anymore. So that's about all I got for you guys today. Hopefully this helped. I just want to put a shout out. I think I've got 100 subscribers now, so I'm kind of excited about that. Thanks everyone for watching. If you have any questions or if you have anything that you want me to talk about in my vlogs, feel free to shoot me a personal message or make a comment. I'd be happy to address that. But yeah, all is good in the home frontier. Now the question is, can she reach Wonderland next week? I don't know. It's going to be tough because this is kind of my PMS week, the week I typically struggle with eating. We'll see. I'll do my best, but if not, what's today? Today's October 20th. 10 days. My goal is to get into Wonderland by the end of the month. 10 days, I could lose 2 pounds. No sweat. So, take care, you guys. Keep those videos coming, and we'll talk to you real soon.